Hi, I'm Nicholas Cassimatis, and I'll be presenting the assessment of spine patient preferences for the location of surgery between a hospital and an ambulatory surgical center in the time of COVID-19. This was an analysis of patient surveys for quality improvement in a single neurosurgical practice. We have no disclosures or conflicts of interest to address. So for a bit of background and an introduction to this investigation, it's important to note that ambulatory surgical centers have been increasing in number in the past few decades, dramatically so, in that they're rather common all around the world, and especially in the United States. The number of spinal procedures able to be performed at an ASC has also increased as well. ASCs have been shown to provide health insurance companies and patients with lower costs compared to equivalent procedures in hospitals. And many patients are still hesitant to undergo procedures outside of the hospital. COVID-19 has created hesitancy for many to go to the hospitals for care, especially during the height of the pandemic, but some of this may still linger. The objective of our investigation was to assess the patient preferences and location of elective spine procedures between ambulatory surgical centers and hospitals. So the authors conducted a survey of spine surgery candidates in a single practice. And again, this was an investigation for quality improvement of a single neurosurgical practice. For our methodology, we created a survey measuring patient age, vaccination status, fear of contracting COVID-19, and preference of surgical location, which was given to spine surgery candidates at a single practice between fall of 21 and winter of 22. A total of 58 surveys were completed by patients, and the surveys again measured patient age, gender, vaccination status, fear of contracting COVID-19, and of course the preference of surgical location. The patient preference for the surgical location between an ASC and a hospital was prefaced with a bit of information regarding the types of procedures that could be performed in each location, as well as the pros and cons, right? Patients were informed that there are limitations to what can go on in an ASC, and that ASCs could only accommodate certain things. Patients with certain comorbidities and age factors may not be candidates for an ASC procedure. And something just to clarify, the surveys had no real bearing on where the patients went for surgery if they did have one, meaning there was nothing that locked people in, so to speak, just by answering the survey. The survey was purely just to gauge patients' thoughts on the matter. So for some of the pros and cons that we listed off to inform the patients and educate them a little bit, ambulatory surgery centers often offer lower costs, slightly faster operative times, lower infection rates, lower rates of stay, or lower lengths of stay, I should say. But this, of course, comes at the expense of a little bit less backup in case there are complications, which, albeit rare, do happen. And, there are limited case types that can be performed in an ASC. Certain procedures are not amenable to that level of care. Surgeries in hospitals are often longer, more expensive, longer lengths of stay with higher infection rates, but the hospital has the benefit of having significantly more backup if, God forbid, a complication happens. And there's certainly more variety of surgical capabilities and the ability to take care of a broader patient population. So the results of our investigation, we had a total of 58 surveys completed. 30 patients responded that they would prefer to have their operation at the ASC, while 28 responded they would prefer to have their surgery at the hospital, which seems like a pretty even split on the surface. The patients surveyed had a range of ages between 25 and 91, with the average being 51. Between preferences of surgical location, no difference was really observed in regards to age, vaccination status, fear of contracting COVID-19, in performing activities of daily living or in healthcare settings. Patients who preferred the ASC had a range of ages from 28 to 88, while the group that preferred the hospital was 25 to 91. A higher percentage of patients who preferred to have their procedures at the ASC had a high fear of contracting COVID-19 in the hospital, with about 73.3% compared to 60.7%. So that's rather dramatic. Here we can see a table of some of our data, and you can see the raw averages for respondents for each, as well as the things we were collecting in terms of age, gender, vaccination status, and then fear of COVID-19 in different settings. Right. We also calculated different p-values to show the significance for things leaning one way or the other. Something we'll dive into more. You can see the gender split. That's rather notable, and it doesn't seem the vaccination really played into patients' decision making or preference, I should say, for either or. So here we have the percentage of patients with a high fear of contracting COVID-19 in a hospital. So patients with high fear tended to prefer the ambulatory surgical center. Again, there are still a fair amount that prefer a hospital, but this is still something notable, right? Furthermore, when comparing patients' preferences by the level of fear contracting COVID-19 in a hospital setting specifically, patients with high fear continue to prefer their procedures to take place in an ASC. Patients with high fear of contracting COVID-19 in a hospital setting also tended to be a little older, 55 as compared to 43, and majority female, 53%. And they also had higher rates of vaccination against COVID-19, with 70% or 76%, preferring to get vaccinated and still holding that stance, which I suppose makes sense. If they have a higher fear of COVID, they're probably more likely to have gotten vaccinated. Here we can see the surgery location preference by fear of contracting COVID-19. So those with high levels of fear preferred the ambulatory surgical center, presumably for the lower rates of infection and decreased exposure to COVID-19 patients. Those with lower fears, COVID-19, tended to prefer the hospital, seemingly valuing the potential backup if there were to be a complication more than the efficiency of the ambulatory surgical center. Some other interesting results, more males preferred to undergo procedures at the hospital compared to the ASC by a fair margin. This occurs with males tending to have lower rates of high fear, meaning men tended to fear COVID-19 less so in the hospital compared to females. Additionally, males reported lower rates of vaccination than did females. Again, this is a small sample size, but still notable. Preference of surgical location by the male gender can be seen here. Again, 64.3% of those preferring hospital were male, whereas only 40% of those preferring the ambulatory surgical center were male. So that's a rather large split. And by inference, right, we can look and say that 60% of those who preferred the ambulatory surgical center were women, and a similar deal, and a little under 40% of women preferred the hospital. So our main takeaways: the results of the surveys showed more or less the expected result. Those with high fear of contracting COVID-19 were averse to having their procedures performed in the hospital, and they showed a strong preference for undergoing procedures in the ambulatory surgical center. Additionally, a strong preference for undergoing procedures in the hospital was seen in the male gender. That's something we didn't necessarily expect to see. The preference of males relative to females for undergoing procedures in the hospital really could not be explained by the results of the survey. The difference in preferences by gender could potentially be due to different perceptions regarding risk, whether in the ambulatory surgery center or the hospital, both of complications and infections, but the evaluation of the so-called backup in case complications did happen may also well be at play. The findings of the survey really highlight the need for patient education in regard to what can be done at an ASC safely, and then what can be done at a hospital, as well as the different steps taken in either setting to mitigate infection. And that just speaks to the fact that a lot of patients don't know about this conversation. So we felt it was important to pose that argument and just give patients the information and let them decide, at least think about it a little bit in their mind. And again, when it comes to actually deciding where a specific patient has a specific surgery, physicians have a one-on-one talk with a patient, figure out what's best for them in their scenario. And thank you. Appreciate you hosting me. And for any questions, feel free to reach out via email. Thank you again.